Welcome to The Explainer. Today we're going on a seriously fascinating high-energy journey to demystify the complex world of eye infections. We're going to break down the anatomy of the eye, starting from those superficial everyday nuisances and moving straight into the deep, literally sight-threatening medical emergencies. It's this incredibly intricate biological landscape, and understanding how infections actually travel through it, well, it's absolutely crucial.
So think about this for a second. Is your red eye just a minor annoyance, or are we talking about a massive medical emergency? Well, by the time we wrap up this presentation, you're going to know exactly how to tell the difference. You'll learn how to read those subtle clinical signs and truly understand the physical borders that separate a simple nuisance from a true, real-life threat to your vision or even your life.
Okay, let's look at our roadmap for today. First, we'll cover spotting the red flags. Second, lids, lashes, and tears. Third, decoding the pink eye. Fourth, the danger of keratitis. And finally, we'll wrap up with deep orbital emergencies.
All right, jumping right into section 1, spotting the red flags. When to panic.
You have to think of these symptoms as your sirens, okay? They are literally screaming that there's a potential threat to someone's sight or honestly even their life. If you or a patient has a sudden drop in vision, extreme light sensitivity, what we clinically call photophobia, or severe pain that just seems totally out of proportion, the alarm bells need to be ringing. The exact same goes for proptosis, which is the actual physical bulging of the eyeball, or if it hurts just to move your eye around. Oh, and finally, if you ever see copious, explosive, purulent discharge in a newborn baby, yeah, that is an absolute high alert medical emergency right then and there.
Moving on to section 2, lids, lashes, and tears, the superficial zone. Look, we've all heard of a stye, right? But in the clinical world, we call this a hordeolum. And what's happening here is actually incredibly simple. It's just a focal, really tender red bump right there on the lid margin. Essentially, it's just a super annoying blocked hair follicle right at the base of your eyelash that got infected, usually by Staph aureus bacteria. Because it's so completely superficial, it almost never needs antibiotics. Usually, you just handle it with simple warm compresses and supportive care. But let's see how things can escalate when we look at your tear ducts. This sequence shows how a simple physical blockage turns into a nasty infection called dacryocystitis. So your normal tears are supposed to drain down the nasal lacrimal duct straight into your nasal cavity. But if that duct abruptly and completely clogs up, the whole flow halts. All that lacrimal fluid backs up, and you get this swelling right at the inner corner of the eye, the medial canthus. And here's a medical rule of thumb. Whenever fluid is stagnant anywhere in the body, bacteria are going to move right in and colonize it. This backup of pressure and the infection that follows, that's going to require oral antibiotics and sometimes even a surgical bypass just to create a completely new drainage channel.
Let's go a bit deeper. Section 3, decoding the pink eye, the conjunctival spectrum.
When we're trying to decipher conjunctivitis, I really want you to remember what I call the rule of contrast. If a patient comes in with a red eye and a watery, kind of gritty discharge, especially if they just had a runny nose or upper respiratory infection, you're almost always looking at a virus, usually adenovirus. You definitely don't need antibiotics for this. It just kind of has to run its course. But if that eye is pumping out purulent, explosive, sticky goop, I'm talking to the point where their eyelids are literally glued shut when they wake up in the morning, well, that points straight to a bacterial infection. And that means you're going to need some topical antibiotics for sure. Now, the specific microbial landscape of those bacterial infections really depends on the patient's history. For your average uncomplicated adult is usually just good old Staph aureus. But if you hear the magic words, "I wear contact lenses," your radar has to instantly go up for a very dangerous bug called Pseudomonas aeruginosa. That one carries a super high risk of permanently damaging the cornea if you don't treat it fast. And the absolute biggest red flag of all? A newborn baby, maybe just 2 to 5 days old, with explosive, copious pus and chemosis, which is basically a fluid blister right on the eye. That screams Neisseria gonorrhea, and you have to treat that immediately and aggressively to prevent permanent blindness. Now the stakes get higher. Section 4, the danger of keratitis, piercing the clear window. The structure directly in our crosshairs now is the cornea. Think of this as the perfectly clear, protective outer window sitting right over your iris and pupil.
Now, what makes the cornea so incredibly unique is its massive nerve supply from the ophthalmic division of the trigeminal nerve. It is jam-packed with sensors, and that perfectly explains why an infection or inflammation right here, a condition we call keratitis, doesn't just give you a red eye. It causes excruciating, drop-you-to-your-knees pain and intense photophobia, simply because those dense pain receptors are highly, highly agitated.
So, bacterial keratitis is often caused by leaving your contact lenses in way too long, as we mentioned. But viral keratitis, that has a truly visceral story. The cold sore virus, HSV-1, doesn't just randomly hit the eye out of nowhere. After your very first infection, the virus literally travels all the way up your facial nerves and goes to sleep. It just lies there, completely dormant, tucked inside the trigeminal ganglion in your brainstem. Then, during times of stress, or maybe if your immune system dips, it wakes up. It reactivates, travels directly back down the ophthalmic nerve, and hops right onto the cornea. Once there, it creates these crazy-looking, branch-like dendritic ulcers that you can actually only see if you use a special fluorescent dye.
Because of all that, the absolute crucial point here is knowing how to spot these nerve-traveling viruses before they completely destroy the cornea. And there's one major glaring clinical warning sign for the shingles virus, VZV, and it's called the Hutchinson sign. If you ever see a singular blistering rash right on the very tip of a patient's nose, listen to me, it means the shingles virus is actively traveling down that specific nerve pathway, and it is actively attacking the cornea as we speak.
And now, the climax of our journey. Section 5, Deep Orbital Emergencies, the climax.
Okay, to really understand these deep infections, we have to build a quick mental map, and we're going to do that using the orbital septum. Try to imagine a really thin, fibrous tissue barrier that essentially anchors your eyelid to the surrounding bone. This septum is the absolute dividing line. It acts like a critical firewall for your body, protecting your deep orbital cavity and, frankly, your brain from outside infections.
Distinguishing exactly which side of that firewall the infection is on is literally a matter of sight and life. Preseptal cellulitis happens anterior, or in front of the septum. You'll see massive eyelid swelling, yeah, but the eye itself still moves totally normally, without any pain. Orbital cellulitis, on the other hand, happens behind the septum. That deep inflammation completely entraps the muscles, causing severe pain, incredibly restricted movement, and it physically pushes the eyeball outward in a scary condition called proptosis. Basically, if the eye is bulging and the patient can't move it, that firewall has been breached.
And let me tell you, this can escalate so chillingly fast. Let's say a patient gets a severe ethmoid sinus infection. That infection can easily break right through the paper-thin lamina papyracea bone, directly into the deep orbital cavity. From there, the massive inflammation allows the infection to travel backward via the ophthalmic veins straight into the cranial cavity. This causes what we call cavernous sinus thrombosis, which means massive, life-threatening blood clots right inside the brain. And because your sinuses are so interconnected, this suddenly jumps to affect both eyes, risking complete facial paralysis and massive intracranial bleeding. It's truly a worst-case scenario. Finally, we reach the ultimate intraocular emergency, endophthalmitis. Now, this isn't an infection around the eye. This is a massive, severe infection, directly invading the actual globe of the eye itself. We're talking specifically about the deep, gel-like vitreous humor in the back. Because the inside of your eye is mostly a closed-off system, this is an exogenous infection. That means it usually requires some sort of outside trigger that literally physically pierces the protective barriers. Think a penetrating trauma from an accident, or sometimes even a surgical intervention like cataract surgery gone wrong. These symptoms, they demand absolute, immediate urgency. We're talking abrupt, complete vision loss and deep, agonizing pain. If you look inside the eye, you might actually see a hypopyon, which is this terrifying, highly visible layer of pus settling in the eye. And, crucially, the normal red reflex you'd usually see when you shine a light in there, it'll be completely absent because that vitreous gel is so clouded with infection. To even have a chance of saving the patient's sight, a specialist has to immediately inject intravitreal antibiotics directly into the globe with a needle. There's no time to waste. So after exploring all this incredible, intricate anatomy, I want to leave you with this one thought. If you woke up tomorrow morning with a painful, swollen, bright red eye, would you know exactly where the real danger lies? Look, medical literacy isn't just about memorizing random symptoms from a textbook. It's about truly knowing the borders of your own anatomy.
It's understanding the massive difference between a simple blocked hair follicle on the surface and a terrifying firewall breach deep in your orbit. Hopefully you now see the red eye not just as an annoying nuisance, but as a fascinating window into the complex, deeply interconnected systems that are constantly working to keep you safe. Keep learning, keep questioning everything, and I'll see you in the next explainer.